Good morning. We are on February 3rd, 2026. We're in the Habits of Health book, and we're on page 233, which is 2.4 in the Habits of Health. So it's actually just before 2.4. This is the story from this guy. So let's read through that. Transformation, David Miller. When I started with Dr. A, I had a background in fitness and managed my healthy weight through healthy exercise and movement. It really surprised me when I did my first health assessment that I was rated in the unhealthy category. Once I dug into the habits of health, I found the areas that I needed to work on. I needed to get rid of my job because it was causing most of my unhealthy habits. I wasn't getting enough quality sleep, and I was able to correct that. I was a competitive cyclist and I burned a lot of calories, but it allows you to eat some unhealthy things that don't really serve your health. I really struggled with sweets my whole life. I was getting sick a lot, and I knew that wasn't a natural thing to happen that somebody my age knew that wasn't a natural thing to happen that somebody my age. I have those habits under control now, and my health is fantastic. I rarely get sick. Before, I was taking antibiotics a lot, and that really manifested itself negatively. Everything was getting worse and worse, even though I still looked healthy because I didn't have a lot of great healthy habits. Those are just a couple of the things that really made a major difference in my life. We're reading David Miller's story on page 233, if you like, Raquel. I was a truck driver, and I was also a father. My real passion was my family, and I wanted to be there for them. I started working nights so I could split up my sleep to be at my son's games and support my children in their activities. But then I realized that the lack of sleep was really affecting me and how I showed up in the world. One of the things I wanted was balance in life. The stress was actually a thing that manifested itself when I wanted to be somewhere and feeling guilty that I wasn't there. I even found that my mental health was worse than my physical health because I wasn't living a life fulfilled. I wasn't doing the things that were important to me, and I wanted to work my way back there. That's why I really wanted to become part of this optimal health community, because I could see an avenue of how I could get to where I wanted to be from where I was. I was getting sick a lot, and I knew that wasn't a natural thing to happen somebody my age. Okay, so now we are in 2.5 today, choosing wisely. Dr. A's color-coded shopping system. The quality of the food you eat is actually more important than the quantity of calories we consume, but both are critical to weight management and eating healthy for life. In part 2.4, Dr. A's healthy eating system, we explained the first component of my simple eating system to manage the quality of food you consume. My innovative plate system was designed to overcome the confusing and complicated pyramid of the USDA approach. It has helped so many clients and patients take control of their energy intake. The USDA has followed my lead. In this part, we're going to study the habits of healthy weight management and the habits of healthy eating and hydration. As I described in the last part, I have made two small adjustments so that my plate and my system are interchangeable. Thereby giving you access to multiple resources. I have taken the fruits and vegetables section, which represents 50% of the 9-inch plate, and separated into two equal parts, 25% and 25%, so you can follow their system. There will still be many times where you will want more of the 50% to come from vegetables, especially in the weight loss phase. I'll make those moments clear. I've also changed the starch category to grains to keep the category consistent. We need to know that starches really should be grains. And he's in optimization is when he uses the 9-inch plate system. In this part, we will now shift our focus to the quality of the food you will be eating, both for weight loss and also to eat healthier food for life. We will introduce my color-coded system, which will make shopping and eating out a breeze. It starts as a simple way to distinguish healthy carbs because many experts in the medical establishment think that learning how to choose healthy, low glycemic foods is just too difficult for most people to grasp, despite the proven health benefits. I disagree. The color-coded approach was so successful in helping people make healthy, low glycemic choices that I extended it to help with all of our food choices. Our simple color-coded charts now make it easy for people to master shopping for healthy proteins, starches, fruits, and vegetables. When combined with our easy visual portion-controlled system, this color-coded shopping system puts you well on the way to creating meals that help you lose weight and build optimal health. And the color-coded system has been extended to give you easy ways to make healthy choices in all of the food groups. If you stay in the green, you will stay lean and healthy. So it's really important to tag this area. So when you're making those choices, if you're when it's time to eat fruit, go in and check which fruits are higher glycemic and lower glycemic and become fully aware of which ones are going to be spiking your blood sugar. Understand that pineapple and bananas are things that I don't eat as often because they're higher glycemic. And I'm going to really encourage you, never eat those fruits without having protein with it. Not a little ways away from it, with it. Because it will spike your blood sugar and then throw you on the ground. So, low glycemic, proven because I wore a continuous glucose monitor, and I did that if you want to know for sure. So, sidebar, eat food, not too much, mostly plants. I like that. So, low glycemic foods for optimal health. The message couldn't be simpler. Staying away from refined sugars and flour and focusing instead on eating low glycemic carbohydrates and healthy food is the best way to lose weight and create health. Many Western nations that, like the US, are experiencing obesity epidemics have embraced the glycemic index, a standard for measuring and consuming the glycemic content of food, as an important way to help people understand how to make healthy choices. And again, I'm going to state, recognize the glycemic index. If our blood sugar is spiked, we cannot burn fat, even if our calories are low. So what would you be burning? Muscle mass. So during the losing phase, it's even more important to keep the blood sugar level. Sadly, the U.S. medical community has been slow to endorse this powerful tool, claiming that it's just too hard for most people to understand. We can get it, right? Since the first edition of this book, some leaders in the nutritional research and obesity have started to come around. As I mentioned earlier, Dr. David Ludlow, a practicing endocrinologist and leading obesity research at Boston Children's Hospital and professor of nutrition at Harvard School of Public Health, has embraced glycemic index. His new book, Always Hungry, is based on glycemic index and load and supports what I have been teaching and the amazing results I've seen over the last 10 or more years. If we move people away from the ultra-processed Western diet and unhealthy carbs, we can turn off insulin and the body stops behaving like a fat storing depot. The system I have developed takes all of the confusion out of shopping and ordering at restaurants and makes choosing and preparing low glycemic foods a breeze. At its core, is a series of color-coded charts highlighting choices from each food group. You can use these charts when you're preparing meals at home, when you're shopping, or when you're ordering food in a restaurant. Here's the rule of thumb for foods that contain carbohydrates. Here's the color coding, makes it super, super simple. So dark green is low GI, low glycemic, best for weight loss and optimal health. Light green, moderate GI, glycemic index, to be eaten in moderation. Yellow is caution, it's high GI, to be eaten rarely. And then there's red, which is toxic, to be avoided at all costs. If you're going to eat those foods, just be prepared not to feel the best. And also, it just does not serve our body at any time. I'm actually going to read this sidebar really quick. Turn down the dial with these easy tips for lowering the glycemic index. Take low glycemic eating even further. Here are some simple ways to help keep your blood sugar under control by lowering the glycemic influence in foods you eat each day. Note, we will address the science behind the glycemic index in more detail in part 2.7. Science of healthy eating and weight loss. By changing your stomach and gut emptying times, we can naturally reduce the entry of glucose into the bloodstream and lower the glycemic index, which can be accomplished by the following. Use vinegar and lemon juice, pickle your vegetables, and select sourdough bread, not in phase 1, to slow down the rate of starch digestion and the rate at which your stomach empties. Interesting. Undercook your spaghetti, oatmeal, and other pasta-like starches. In other words, cook them al dente to slow digestion and prevent starch from gelatinizing. Use stone ground rather than fine milled flours. Larger sized particles, less refined, have a lower glycemic content. If you eat higher glycemic foods, which should be avoided during the weight loss phase, combine them with low glycemic choices to lower the overall effect of the blood sugar and the glycemic content of the meal. All right, back to the regular part. If you begin your journey in phase 1, the weight loss, your healthy eating selections should come from the dark green charts. These foods are highly effective at turning off your insulin and fat storage and will facilitate reaching and maintaining the optimal weight. Again, if your GI is high and you spike your blood sugar, you cannot burn fat. The light green charts list foods that are healthy but should be used sparingly in the first phase of your journey. Foods on the orange, I say yellow, orange chart should be used with care and caution only after you've reached optimal health. And any foods that are in the red is directly damaging to your health and should be eliminated completely from your diet forever. However good they taste, they are not worth it. And I was thinking about this the other day. I look at some of those things and it's like, wow, I'd really like to have a burger that's, the bun is grilled and it has onions and bacon on it. I'd like to do that sometime. And then I really think, I don't go out to eat very often. And if I go out to eat, a Cobb salad, which is a little bit higher in fat. So if I want to be bad, a Cobb salad actually serves my body if I don't have the bacon. If I want to be bad, some of those healthy things taste so good. Why would I do something that would make me feel like crud afterwards? Really, some of the things that I eat, there's at the Mexican restaurant, there is a shrimp and mushroom grilled thing, and I have a salad with salsa on it and no tortillas, rice or beans. Even in optimization, why would I not have that instead of that thing that was just going to really not be good and damage my health? If I start thinking about foods that are not going to serve my body at all. And then I shift and I look at those things that taste absolutely phenomenal. Why would I choose that? Anyways, that's some of the processing that I have going on. I'm 11 years into my journey. I'm still processing that stuff, but I think it's important that we do keep processing that stuff. So anyways, wow, another side note. Let's see. Any and any food that is in the red is directly damaging to your health and should be eliminated from your diet forever, however good the taste. Okay. And of course, the prepackaged low-calorie fuelings are designed specifically to provide high-quality, low glycemic choice and are always an excellent way to obtain nutrition-dense, calorie-friendly fueling or meal. They're always designed dark green. I love that. They're always designed dark green. So all of our fuelings are dark green on the glycemic index. So, and again, choose dark green to stay lean. The power of food. One criticism of current diet advice is that it really doesn't help people distinguish between healthy and unhealthy choices. I say this all the time. They need to have the glycemic index on foods. I don't know why they wouldn't when, what is it, 80% of people are pre-diabetic or diabetic? So one group is verifying sugar, and another is saying that high fat is the problem. The advice doesn't consistently discourage the consumption of red meats, high in saturated fats, or encourage the use of healthy enhanced oils. It gives equal classification to energy-giving, whole grain products and the health-robbing refined grains found in many processed foods. My plan, however, teaches you to replace the processed foods that have a powerful healing effect on your body by choosing healthy foods from a designated major food group in the color-coded way. You will have a simple system to allow you to be able to choose healthiest options. This will allow you to tap into natural ability of nutrient-dense foods to actually improve the health of your cells, thereby putting you in an ideal state to shed excess weight while moving you from non-sick to optimal health. In essence, as we eliminate the health-robbing effects of an unhealthy food, we'll be using food to heal you instead of medicines to treat symptoms. Again, I'll state, I reversed rheumatoid arthritis 11 years ago, 10 and a half years ago. I reversed Hashimoto's 10 and a half years ago by balanced habits of health. Not just the food that I ate, but balanced habits of health. So think of it as removing kryptonite so your body is no longer exposed to toxins and metabolic negative switches and is instead using health-restoring quality meals that turn on healthy biological pathways and genes. It's all part of an exciting new discipline that lifestyle physicians like myself have defined as nutritional intervention, as a much more powerful medicine than any pharmaceutical I've ever seen. And it's the very basis of creating optimal health and well-being. So why would a critical care physician who spent over 20 years using pharmaceuticals now abandon a drug-based approach for a healthy nutritional approach? Simple. In those 20 years, I never saw one of my medications create radiant health. But over the last 17 years, we have seen that by providing nutritional intervention, we can witness the almost miraculous reversal of multiple unhealthy conditions. Providing healthy food has the power not only to resolve pre-obesity, hyperinsulinism, and other unhealthy states without dangerous side effects. It also creates a platform for optimal health that traditional medicines cannot provide. I like to call the healthy foods we'll be selecting functional foods, a term first used in Japan in the 1980s to describe foods that provide particular health benefits. In my plan, I use the term to describe foods that add value to your body and move you up the path towards optimal health. It's one way of thinking of the nutritional intake as good medicine. This new way of looking at food will unlock a whole new healthy world for you. Understanding how to select foods from optimal health is just as important as managing the total number of calories you consume, if not more. So, in fact, the habits of health you're about to learn are among the most important daily decisions you can make. Okay, I'm going to read the sidebar. For your convenience, we can also download my color-coded shopping chart from habitsofhealth.com or find them on the Optavia app. A habit of health. Choose low glycemic carbohydrates, lean proteins, and healthy fats. And we're also going to learn about healthy fats. It's so important to recognize there are unhealthy and there are healthy fats. But I think a lot of times, since they put both of them on the list to be able to choose from, we don't read the paragraph above that says, usually choose the unsaturated and the polyunsaturated versus the saturated fats. But we're going to do a deep dive into that also in here. So the one thing we know for sure is when someone from anywhere in the world is exposed to the modern American diet, MAD, M-A-D, the result is the same. Obesity, poor health, and disease follows. I also know that we all have a body that we want to be healthier. I took an oath many years ago that stated I would first do no harm and help people improve in any way I could, and the health benefits of an emphasis on eating healthy foods far outweighs any benefit that comes from medicines that most just relieve symptoms. Wow. How powerful is that right there? In fact, I'm going to read that again. I took an oath many years ago that stated I would first do no harm and help people improve in any way I could, and the health benefits of an emphasis on eating healthy food far outweigh any benefit that comes from medicines that mostly just relieve symptoms. Right there. That's why he walked away from regular medicine and moved over here. Okay, sidebar. One reason people get confused about glycemic content and the glycemic index is that some foods that are low glycemic can be high carbohydrate. So how can you avoid picking the wrong foods? First, just choose from the dark green chart. And second, be sure that your portion size fits in the right compartment on your 9-inch plate. As long as you stick with these two basic rules, you'll keep your insulin levels stable and your fat storage machine turned off. The charts are available for download on your app and the habitsofhealth.com. They're also in your Lifebook. So, Western diet versus traditional diets. And there's the graph. Up at the top is in the green is healthy food, radiant health, and then at the bottom is chronic unhealthy foods. So how do we make, oh, we're doing on time, okay. How do we make our choices all green to help us heal and improve our health and our well-being? It's going to take a decision to make nutritional intervention of your very own, along with some knowledge, some tools, and some coaching, and some habit installation. Let's start with some history and background of the evolution of eating and the birth of food technology in Western countries. What makes most of the MAD diet so bad for us is how do we stop the madness? The industry revolution changed food forever. For over 10,000 years, we ate a rather simple diet rich in fruits and vegetables, high in fiber and macronutrients, low in salt and sugar, and essentially free of trans fats and low in saturated fats. 100 years ago, food industrialized changed the food industrialization changed everything. Starvation was a major international crisis, and the food industry was asked to help eradicate this significant world issue. We asked for cheap, readily available, and easy to ship and store food to help feed the world. Unfortunately, we forgot to ask for it to be healthy. Now, as amazing as this will seem, there are more people who are overweight and obese in the world than there are people starving. Wow. Now, as amazing as this will seem, there are more people who are overweight and obese in the world than are starving. Well, what happened? It starts with refined flour, grains. Grains are made up of three parts: the bran or hull, the germ, and the endosperm. Whole grains have all three, while principal component of refined grain is the least nutritious component. The advancement in technology created the ability to mill with a still press and separate the starchy white endosperm away from the germ in a grain kernel. Overnight, flour changed from being nutrient-packed, but with short shelf life, to a white powder that was highly digestible, high glycemic index, cheap, and long-lasting, but with almost no nutritional value. Sugar follows a similar story. Originally, the coarse sugar found in beets and sugar cane was costly and difficult to purify. People chewed sugarcane raw to extract its sweetness. Over time, via advancing processing technology, we now have refined sugar, which, like flour, is a white powder that lacks any real nutritional value. Okay, and we're going to stop right there, and then we're going to step into white powders next week.